Cindy Scribner, a registered nurse and mother of 4 daughters, was having trouble breathing.
Her lungs were never going to recover. She was scared, and she tried not to show her children that she was scared.
Just days after hosting a backyard party, Charlie Atkinson began to slur his words and was suddenly unable to walk.
It was West Nile virus. No treatment was possible. What was possible was keeping him alive.
26-year-old Ben Clancy had just landed his dream job. A night of celebration would cost him.
The EMTs were able to come and revive him and bring him to Mass General, where we found him, and he was unconscious.
These are 3 of the patients in Dr. Daniela Lamas's new book, You Can Stop Humming Now. The book takes readers inside the critical care units of Boston area hospitals, where top-quality staff and cutting-edge technology often triumph over even the most desperate cases. But at what price? The book's central question: at what point does intervention become too much?
Mind if I just take a listen to your lungs? I'm an ICU doctor, so my clinical experiences during fellowship were largely in the intensive care unit. That's where these stories come from. Sort of the nidus of them is all in a critical moment. But what I try to do in this book is to look beyond the ICU at what happens to people afterwards. And so that takes me from the ICU into patients' homes, into the world with them.
28-year-old Cindy Scribner's symptoms began with shortness of breath and a tickle-like cough. At first, doctors said she was fine, but her cough persisted. Months later, while at work, she had trouble breathing. Doctors discovered her lungs were failing.
Cindy was stricken with a scarring disease of her lungs called pulmonary fibrosis. She got on the transplant list, but then she got so sick that if it were not for this machine that would serve the purpose of her lungs, she would have died.
In her room at Brigham and Women's Hospital, the machine that kept Cindy alive is called an ECMO.
So extracorporeal membrane oxygenation is a machine somewhat like dialysis for the kidneys that serves the purpose of the lungs, and it draws blood out of the body through a large catheter, often in the neck. It's not good enough that you can leave the ICU with it.
Cindy's husband and daughters were regular visitors, boosting her spirits and resolve. But living on the ECMO was more than challenging. It was brutal.
She suffered significant complications while waiting. She had a lot of problems with bleeding. And with each bleeding episode, she became weaker. And her doctors and Cindy herself started to wonder whether perhaps what she was going through for a diminishing possibility as time went on of a transplant, perhaps that pain outweighed the increasingly unlikely benefit.
Weeks turned into months. After almost a year in the hospital and over 2 months attached to the ECMO machine, Cindy Scribner had her 23rd stomach bleed. Her surgeon was on his way into the hospital.
And as he made the calls to book another OR and thought of Cindy and her children and the weeks and weeks of suffering that they had gone through, he wondered, so he told me, whether perhaps this wasn't the right thing to do, that maybe they had gotten to a point where they were all so connected to this patient. Perhaps they weren't able to see that what they were doing was to her instead of for her. The burden was on her team to say, we see that you're suffering, a transplant is becoming less likely. I think the worst thing that we sometimes do is just go on and don't offer that pause point and offer people to say, yeah, I'm done.
That day, Cindy Scribner made an agonizing decision. She could not go on. She said goodbye to her husband and 4 daughters.
Later that evening, like after going through all that and getting to terms, like I was all set with everything and saying goodbye to everybody, he comes in and he was like, well, I know we're not doing the surgery, but I found lungs for you. And that was the last thing I remembered.
At the moment Cindy Scribner was ready to die, she was given an opportunity to live. On November 1st, 2014, Cindy Scribner underwent a double lung transplant.
And I woke up the next day with lungs, and I could breathe. And it was like amazing. I couldn't believe it. It was like a miracle.
Regular visits by Cindy's husband and children were key to her recovery, Dr. Lamas says. She adds that she often sees positive outcomes for patients whose families visit frequently. And another plus to those visits, doctors can learn more about their patients from family members. Well, next, a mosquito bite turned his life upside down.
The idea that I'd ever go home was a fervent hope and a distant dream.